My name is Dr. Nisha Khot. I am the President of the Royal Australian and New Zealand College of Obstetricians and Gynaecologists, RANZCOG, and I'm also the Clinical Director at Bayside Peninsula Health Network, which is based in Melbourne. When I started out in medicine, I had absolutely no interest in obstetrics and gynecology, which I have to be honest about. My interest was in pathology, and I saw myself becoming a pathologist. However, for some reason, I did well in obstetrics and gynecology as an undergraduate in my exams and in the various assessments, and so started out as a junior doctor in obstetrics and gynecology. Again, not with a commitment to staying in it. In fact, it was a very hard junior doctor role, and there were many times in the early years when I felt that this was really not for me. I was not cut out for this kind of hard work. I would much prefer the easy 9-to-5 life of a pathologist. But I stuck it out, and at the end of the year of being a junior doctor, I realized that actually I did love this specialty, and that it was a specialty that was perhaps not given as much importance as other specialties because it was a women's health specialty. It was sort of always pushed aside to one corner of the hospital, of the general medical fraternity, and was not considered the sort of specialty that people who really wanted to make a success of themselves would choose to do. And so I stuck it out and have enjoyed this journey of obstetrics and gynecology. I started my training in India. I then moved to the UK and retrained there, and then moved to Australia. And in every country, I have seen that actually women's health does become a Cinderella specialty, if you like. It's something that doesn't get as much importance, as much funding. And so it spoke to some of the very core values that I hold. And I think I may have started out as a feminist, but certainly doing obstetrics and gynecology has cemented that feminism within me.
Welcome to the first hearing of the Select Committee on Birth Trauma. This inquiry is examining the experience and prevalence of birth trauma across the state. The inquiry will address the growing concerns surrounding the rates of birth trauma and consider what legislative, policy or other reforms can be enacted to prevent birth trauma.
We welcome the New South Wales Government and Members of Parliament's passion and drive now to assist in this process, which we hope will see result in additional funding and research, as well as policy and legislative changes, and we will see a difference that extends out to all women and families in Australia.
There have been a couple of recent inquiries into birth trauma, one in the UK and the other is the New South Wales Select Committee's inquiry into birth trauma. These have revealed that women are suffering not just from physical trauma after birth, but also psychological trauma, which is something that we have not addressed very well in our healthcare system. And so these systemic failures aren't just a failure of an individual. They're usually failure of recognition across the board from the multidisciplinary team. And it's important that we work together. After all, in our clinical work, we are working as a team, and to address birth trauma as well, we need to be working across all the disciplines, midwifery, medicine, allied health, to make sure that we are addressing what women are telling us is a traumatic experience for them. In 2025, we had some funding to run a pilot project to address birth trauma. This project was a workshop project based on interdisciplinary and multidisciplinary education for the entire team to recognize birth trauma, address it, and manage it sequely. This was only a pilot project, and it was run across a few different sites in Victoria, New South Wales, and WA. It was very successful, and what feedback we got from participants was that they found it very useful. We are hoping that we will get some more funding so that we can roll this workshop out across the country to all maternity units. First of all, to do with birth trauma, I think we still don't completely understand where we should be, putting our efforts into. We do recognize that part of birth trauma has to do with consent, it has to do with education, it has to do with information. And so it's important that we continue those conversations around that in a multidisciplinary team, which includes obstetricians, GP obstetricians, midwives, as well as allied health practitioners and mental health practitioners, psychologists and psychiatrists. I think it's really important that we continue to have that conversation that brings together both physical and psychological trauma and make sure that we address all aspects of trauma for women. More broadly, women's health has been always something that hasn't been adequately recognized and funded. It is good to see that there is more recent recognition of women's health conditions and the fact that there hasn't been enough research into them. I would like to see more funding for women's health.